because they're both very powerful, and there are some couple of tricks that you should know how to combine them so that they work effectively. So I have integrative pain management practice, and we use different modalities. Michael said that actually all neural therapists that I know use not only neural therapy but something else, right? So we combine it with trigger points, with homeopathy, nutrition, food sensitivity, so a lot of other things. The problem that I wrote this book, for example, for doctors who want to start using homeopathy but who don't know how to start, who think that it is time-consuming and it's difficult, right? And I understand them, because initially when I started doing homeopathy, it took me quite a while to get enough information to prescribe the remedy, right? And I practiced homeopathy for probably 40 years, because I graduated from medical school in 1980, so it's already 40 years this year. And I started using homeopathy right from the beginning, actually. And then I got a formal education in homeopathy in New York School of Homeopathy, which was a 4 years of training. And then I went through a bunch of workshops by leading world homeopaths. And eventually I created my own style, how I find remedies. And now, if, for example, at the beginning, it could take me an hour to find the remedy, now I just, by the end of interview, I know which zones to inject and I know which remedy to give. So it actually can be quite simplified. So we'll go through basic stuff like headaches, how we classify them, why we use homeopathy, the most basic essentials of homeopathy. I have a special attention to post-traumatic headaches because there's a lot of them and we miss them actually. And I will give you some practical hints for successful prescribing, how to prescribe on different aspects of the case, on localization of headaches, on what makes headaches better or worse, how to prescribe on concomitant symptoms like vomiting, or this kind of things. And as we do that, I will give you some tips how I choose zones for injection based on localization of pain, on causation of headaches. So headaches are classified in primary and secondary, and actually numbers are mind-boggling, because like up to 50% of population suffer from tension headaches. Migraines considered like 14.7%. And if you think about it, it's 1 billion people on this planet. And then secondary headaches, we'll talk about post-traumatic headache and sinus headaches. We're not going to talk about headaches due to tumors or vascular catastrophes, this kind of stuff. So, a couple of words about migraines. This is the third most prevalent illness in the world. And most of headaches, migraine headaches, happen between ages of 25 to 55. And they are 3 times more common in females, which have practical implications for choosing homeopathic remedies, because some of the remedies that we use are considered more suitable for females. Most of migraine attacks are unilateral. They are accompanied by visual disturbances, nausea, vomiting, and I found recently that migraines are the most common ailment mistakenly diagnosed as multiple sclerosis, which was, and I see why. Cluster headaches. There are not that many of them, but if you have them, this is really a challenge in a way. Because these are the most violent headaches. They have sudden onset and sudden ending, and they have this unilateral autonomic manifestations: red eyes, swelling around eyes, tearing, drooping eyelid, this kind of things. But I will explain you will see how to treat them. Tension type headaches, they're less severe, but still they are very bothersome in some cases. They can make your life miserable. But they don't have or vomiting sensitivity to light and noise. So in terms of causes of headache, in some cases psycho-emotional factors are in play, and in these cases physical they just physical expression of anxiety, underlying anxiety or depression or anger. Some patients point at stress as a cause of their symptoms, but stress also falls into this realm of psycho-emotional factors with underlying emotion of fear. Genetics plays a role for migraines and cluster headaches, but it doesn't help us neither to choose those nor homeopathic remedy. In my experience, food sensitivity is a big thing in headaches. And it's a big part of my practice also, but it deserves like a special talk. And in my book, actually, there is a special chapter on this subject. Sinusitis and post-traumatic headaches, we frequently miss them, and we explain you why. For example, sinusitis, what happens when I interview the patient, they don't even tell me that they had sinusitis, right? Because it was long ago, they forgot about it, and now they may have something like mild symptoms of hot nasal drip, and so we have to really dig into the history of the patient. The list of conventional pharmacological and surgical treatments of headaches is really impressive, even in this incomplete version. For example, when I look, I'm always fascinated with creativity of doctors. They come with all these new ideas of how to do cryoablation of sphenopalatine ganglion and all kind of stuff like that, which we would not even think of doing, right? And every year we have a number of new medications coming to the market, and each of them have its own unwanted side effects. And this fast-paced expansion of the list and creation of new destructive ways of surgical treatments reflects the dissatisfaction and desperation of patients regarding the treatment results. So we use homeopathy because it's non-toxic, there are no side effects, and Samuel Hahnemann, who actually is the father of homeopathy, he started his homeopathic career with conventional doses, and then he started diluting medications to avoid side effects while keeping the curative effects of the medications. Another reason why I use homeopathy, because it's not addictive, and of course because the other treatments didn't work, and that's actually the bulk of the patients that we see. Those who went through everything and then they just come to have something else that could work. So the most important principle of homeopathy and its basis is this law of similars. And the law of similars in a brief can be summarized that like cures like, which means that the substance that brings on symptoms in a healthy person can treat a patient, sick person with a similar symptoms. So, and this is actually the main thing about homeopathy, because people are talking about small doses, which is important, but in fact this is the main thing. We have to match, to find the correct remedy, we have to match the toxicologic picture of the remedy to the symptoms of the patient, and then we're in good shape. So potencies, we have different ways of choosing potencies, and this is maybe also important. And traditionally we have it in decimals, and today Hans Pierre was talking about using convallaria for some cardiac condition. So it was an X potency or D potency. And centesimals. In United States we traditionally use centesimal scale, and basically what it means that a substance is diluted successfully 100 times its original volume at each stage. And 6C, when you see on the remedy written 6C, it means that the remedy was diluted 6 times 100-fold. So small dilutions were traditionally used to treat physical pathology. Dilutions 200C and higher we used more to address psycho-emotional issues. So now, there is no universal remedy for headache, right? So it's not enough to have a diagnosis of headache, or even if you know that it's a tension headache, or it's a migraine headache. We have to know more about headache, and we have to know more about patient and his peculiar way of interacting with environment. And this is actually, in many cases, is the most important thing to know to prescribe homeopathic remedy. So we prescribe homeopathic remedies on what makes this patient with headache different from other patients with headache. So we can prescribe on different aspects of the case. For example, based on localization of headaches, on distribution of headaches, on quality of pain, based on concomitant symptoms, on what makes pain better or worse, on etiology, on timing and pacing of symptoms. So while some remedies work better for left or right-sided headaches, there are remedies that work better for bilateral headaches. And I mark with bold those remedies that, in my experience, are the most frequent ones. So when patient, let's start with bilateral headaches. When patient presents with the headaches that start in the occiput, in the back of the head, and extend forward, I think of two remedies. So you see, I made it simple. I see this kind of headache. This is where what I look at. Gelsemium and Silica. Gelsemium is actually a jasmine, and Silica is a quartz. This is how it looks like. Silica I marked in black, and the gelsemium I marked in red. So Silica headaches start in the back of the head and project, extend to the eyes. So you may catch patient in the moment that he have headache in the back of the head or already behind the eyes. And gelsemium headaches start in the back of the head and then they engulf the whole head. To further distinguish between these two remedies, I look at other things, like other symptoms. For example, vertigo and weakness are more specific for gelsemium. And weakness and gelsemium kind of headaches come in a sensation of very heavy eyelids. They may not say it like that because everyone is different. So one of the patients, for example, told me, my eyes are stiff when I have headache, right? Another said, I have difficulty seeing when I have headaches. So it took me just a minute of questioning to understand that what she meant was a very heavy eyelids. Silica patient, they have severe photophobia. They feel better in a dark room. And these guys, actually, some other remedies also have this photophobia, but in Silica it is very pronounced. And there is only one remedy that has more photophobia. It's called belladonna. We'll talk about it in a couple of minutes in the right-sided headaches. So Silica patients frequently have subclinical or clinical hypothyroidism. And they have all the symptoms of hypothyroidism. They are chilly, and actually it is one of the chilliest remedies in materia medica. They are usually constipated, they have brittle hair, brittle nails, so the whole picture of subclinical or clinical hypothyroidism. So this is a case study of Silica that I had, a 72-year-old woman who came to me with typical Silica type of headache. So this one, that starts in the back of the head and projects head and then extends to the eyes. But the main chief complaint was constipation, which she had for the whole life actually. And she was hypothyroid and she knew about it, right? But she refused to take any medications for, she didn't want to take the Synthroid. And her TSH was 54, like it was the first time I've seen it that high. So I gave her Silicia, and TSH dropped in like 3 weeks to 23, and then actually in a month it was at 11, which was like a miracle. So it resolved her headaches and constipation.
What concentration of Silicia did you give her?
Yeah, well, I will talk about potencies at the end because this is like what do I do in cases when there is a headache of this type, for example, bilateral or even unilateral, but the one that, let's say, starts in the back of the head and goes to the eyes, right? So of course, crown of thorns is sort of a main thing. You can use it for anything. And if you notice, every point of this crown of thorn is one of the trigger points. Remember, we just talked about it on this. Yeah, it's all trigger points. In temporalis muscle, there are 4 of them, so you just choose which one is painful. In the occipitofrontalis muscle, in occipital belly and frontal belly, and gallia paneurotica. Actually, gallia paneurotica is very interesting. It looks like there is no trigger point, but when Jeanette Travell, she describes it, when they injected hypertonic saline there, patients got severe headache in the back of the eyes. So we use it for reason, actually. We always consider low wisdom teeth in patients with migraine headaches, right? Because this is a frequent interference field. In patients with Silicia type headaches, I always inject thyroid. I actually like injecting thyroid in many cases, but in Silicia headaches, it's a must because they are subclinically or clinically hypothyroid. So this is a list of those trigger points that I found most frequent that refer pain to the eyes. This is the occipital belly of occipitofrontalis muscle, suboccipital muscles, splenius cervicis, and gallia paneurotica. We spoke about it. So this is the occipitofrontalis muscle that we inject in this type of headaches. This is the suboccipital muscle. Suboccipital muscles, it's a little bit tricky to inject because they are actually located practically at the base of the skull. And there is a vertebral artery there. So when you inject it, it's really, you have to be very careful if you, of course, don't have an idea to inject this vertebral artery. Splenius cervicis is another one that gives headaches in the back of the eyes. And these are trigger points that the most frequent ones in my experience that give headaches in the forehead. And of course it is the frontalis belly of occipitofrontalis muscle. It is the anterior trigger point in temporalis muscle. It is a lower portion of masseter, right? But when you inject these points, you really have to understand that these are secondary trigger points. And the primary trigger points are located in the scalenus, or sternocleidomastoid, and in the upper portion of trapezius. So these two must be injected in all cases, right? Then you will most probably resolve these points. So these are remedies, another 5 remedies that are of use in bilateral headaches, in my experience. And mercurius is actually mercury, right, made from mercury. And the hallmark of mercurius headaches is that headache feels as a band around the head, or they sometimes say like a helmet over the head. Right? Iris, I think of iris in cases when there is visual aura preceding headaches, or some kind of diminished vision, this kind of things. But the main thing about iris is that when they vomit, and they frequently vomit, they have extremely sour taste in the mouth, and they will tell you about it. They say that they feel like as if there is vinegar coming out. Right? Pulsatilla, it's one that is called, we call it female remedy. I frequently use it for headaches in menopause. It can be in the forehead, in other places. It's not the main thing about them, where it is. They are worse with worms, with the sun, of course with the menopause, and they lack being in fresh air. Stephysagria is interesting remedy because I think of it when there is a suppressed anger in the patient, and usually it comes after confrontation. Glonoid is a remedy made from nitroglycerin, and when we give nitroglycerin to patients, some of them develop severe pulsating, bursting headaches. So for this type of headaches, it's better to use Glonoid. It works better for bursting type of headaches. These patients are worse with heat of sun, with any kind of heat, and some of them actually develop headaches after they had a sunstroke. So if there is a sunstroke in the history of the patient, this is one of the remedies that I think of. Now, there are different remedies for right-sided headaches. So let's start with those that give headache above the right eye. Chelidonium is the remedy that is indicated in liver and gallbladder disease. And actually, we use this point to treat, in neurotherapy, to treat problems with the liver, right? Calibichromicum I use mostly for headaches due to sinusitis, right? And the hallmark of it is actually the sort of main symptom, yellow sticky nasal discharge. And sticky is the key word for this remedy, sticky discharge. And these headaches are better with warm application. And there are actually few remedies, few types of headaches that are better with warm applications. Usually patients like to put cold packs, right? So if you see someone and he tells you that, well, this is warm application that I use, is think of calibichromicum and see if you miss some history of sinusitis in the patient. Sanguinaria is very frequent right-sided headache remedy. The main thing about it that it is better with vomiting. So if patient vomit and feels better, I think of sanguinaria. So sanguinaria type of headaches, they start in the right side of the neck or in the right shoulder, right deltoid area. And the interesting thing about it, that it starts in the morning and the intensity of it changes during the day. So intensity changes with the sun. So the headache starts in the morning, gets worse by noon, and then decreases by the sunset. And again, vomiting improves the headache, right? Now, there are 3 more remedies for the right-sided headaches that I consider. Magnesia phosphorica is a right-sided headache that is better with hard pressure, right? And it's very intense and sudden. And sometimes gives like a neuralgic type pain. Semicifuga is a female remedy that is basically semicifuga, if it is on the right side, it is on the right side of the occiput and then feels like a nail in the occiput coming from the neck, right? It's worse with menses, and interestingly, semicentrifugal headache gets better with eating. So when the woman, usually it's a woman, when she eats, she feels better, but then when she stops eating, it comes back again. Right? And the belladonna, and if you remember any remedy from today's talk, it should be belladonna, because this is the right-sided headache remedy. This is the full name of the herb, Belladonna atropa. It contains alkaloid atropine with anticholinergic effects. So the whole clinical picture of belladonna headache looks as if the patient was injected atropine. They may have tachycardia, intense pulsation of carotid, sensation of rush of the blood to the head, and the patient actually, the face may look red, and the head may even feel hot, and they put cold packs there, right? And they have a dry mouth and mydriasis. So, and these dilated pupils is the reason why they have the most severe photophobia. If you remember, like, there is 3 words to remember about belladonna headaches. It's violent, sudden, and photophobia. And if you remember at the beginning I said about cluster headaches, that's actually a hallmark of the cluster headaches. They're all violent, they're all sudden, and if there is photophobia, that's belladonna. So headaches are worse with the light, so they tend to stay in the dark room. They may be aggravated by menses. They are worse, they start actually usually after 3 p.m. They suddenly, and they may go like for a few hours or even overnight, and suddenly, and they don't tolerate any heat in any form. And they may be even worse, the headache may be even worse with sudden jarring, for example, of the bed. And they are better in a dark room with a hard pressure, with a tight head bandage, and with cold applications. And this is belladonna. And if I do neural therapy, of course, besides the crown of thorns, which is good for almost any headache, stellate ganglion, because they have tremendous sympathetic outflow. So to break it, stellate ganglion is the best for this, especially if it is right-sided, so you do it on the right side, of course. So this was a case that I had 10 years ago, probably. A 55-year-old woman who, wife of the doctor, who she brought her to me. She had severe right-sided migraine headaches, few times a month, and they were bad. And they started suddenly in the afternoon, and then suddenly, usually at the end of the night. Usually when this kind of headache ends, they feel exhausted, right? So she couldn't work next day. And she had severe photophobia, and she stayed in a dark room, and not only in a dark room, but also isolated room, because she couldn't even tolerate vibrations of the floor when someone was walking there, right? So these are 2 main remedies for right-sided headache, belladonna and sanguinaria, right? And we distinguish them because belladonna has sudden onset, sanguinaria has gradual increase and decrease. Belladonna headache starts in the afternoon after 3 p.m. Sanguinaria starts in the morning. Vomiting doesn't improve headache for belladonna, and sanguinaria, vomiting improves headache, right? And photophobia is more specific for belladonna. Sanguinaria usually not that photophobic. And sanguinaria patients frequently complain of very right deltoid. So, and as I was actually preparing for this talk, just this Monday I had a patient exactly who came with this right-sided headache here, and I was choosing exactly according to this, and this was sanguinaria case. So that's how I choose. When I look at again at this type of headache, sanguinaria Usually, if it takes the full right side, it feels like half a bend around the head. So, and in terms of trigger points that I always check for, it is suboccipital muscle that gives this type of headache. And of course, splenius cervicis also. So left-sided headaches, they call for different remedies. Sepia, bryonia, thuja, spigelia, lycosis, and ferrometallicum, those that I most frequently see in my practice, right? And to distinguish them, like sepia is a female remedy also, right? Okay, let's look at it. These remedies, like sepia, bryonia, and thuja, they start usually in the left temple close to the left eye and then extend to the back of the head. And the spigelia headaches start in the back of the head and they extend to the temple close to the left eye. So you see, it's quite simple to choose the remedy. You just look at it, where it starts, where it goes, right? And then you know that I have to choose between these three or this one, right? These two remedies, lycosis and ferrometallicum, are fixed. So they will not tell you that headache started in the back and went forward. They start here and they stay here, right? And around the left eye. Sepia is the most important aspect of sepia headaches is that they are better with violent exercise. So if someone, usually it's a woman who have it, actually I didn't see any man with sepia, who I gave sepia. If I see a woman who tends to run every day like 10 miles, 20 miles, I always think is it sepia type of situation, right? Bryonia is interesting because it's worse with, this headache is worse with any movement, even movement of the eyes. Thuja is quite tricky to prescribe, we'll talk about it. It usually on the left side feels like a nail in the left temple. Spigelia, the main thing about it that it is a pain in a small spot in the left side, right? And lycosis is a female remedy, and it is left-sided in the temple, left temple. The main thing about lycosis headaches that they are worse with suppressed menses, meaning that headache is worse before menses start. When bleeding starts, women feel better. Headache gets better. So this is very important thing about lycosis. And ferrometallicum, which is here, right? I think of this remedy when there is iron deficiency. Nowadays they may be on iron supplements, so you will not even see this iron deficiency, right? But they may be orthostatic still. Or I look at things like MCV, low MCV, for example, like mean compostular volume, right? So which is maybe a subtle sign of iron deficiency. Or just look at the stores of iron. If iron is low, so I think of ferrometallicum. And this is a case of a 64-year-old woman who came with the headaches in the left temple or the left eye. Headache started in the morning all the time and on waking up. And this is actually another important symptom for lycosis. They wake up into aggravation. And to the degree that sometimes they don't even want to go to sleep because they know they will wake up with a headache. Right? These patients, this remedy lycosis, we consider it sort of warm remedy, right? We call it warm remedy. So they don't like hot environment and they prefer colder environment, right? So when I put these things together, she's menopausal, meaning that menses are suppressed. Headaches, left temple headaches, start upon waking, and warm remedy. So I gave her lancashire, and that was the end. I didn't even inject it. And actually, it's another reason to use homeopathy, because some people don't want to be injected, right? Especially kids, by the way. Now, a little more about Sophia, but the main things I talked already, that they worse with menses, and intense exercise improves the symptoms. Right? Bryonia headaches, you just have to remember that they are worse from any movement, and even movement of the eyes. So now if you think about your patients who you saw with headaches, some of them probably told you that I can't even move my eyes because it's so painful, right? So I think of bryonia immediately. And they feel better when they press on the painful area, or they may lie on a painful side because it's also kind of pressure. And they lie still. They don't want to move because this is painful for them, any movement. This is warm remedy. And also, these patients have a tendency to gastritis, gastric ulcers, they may not have it at the moment of the headache, but they have it usually before that, or you can find this info. But in some cases, the pain in the stomach precedes the headache. And when I see patients with bryonia type headaches, I can see the interference field in the area of the stomach, and I treat the stomach for these patients. I had this case, 60-year-old woman who I tried to find a remedy for anxiety and depression, and for a while, and I couldn't. And it's difficult, to find sometimes remedy. So, and not even myself, actually, world-leading homeopaths saw this patient and they couldn't find it until she came with a headache. So, and that's what's good about headaches, that when I can't find the remedy and the patient have headache, I know how to find it through the headache. This is like a door for me into some of the patients, right? So the headaches were in the area of the left orbit, and she came pressing on the painful spot, right? So initially, spigelia may look like that because it's a pain in the small spot, right? But spigelia doesn't really press on the spot, right? This woman was pressing on the painful spot. So this is more bryonia. And she had a very dry mouth and the stomach pain. So dry mouth is specific for bryonia. And actually, just another thing too, maybe if you remember that, when cows eat bryonia by mistake, right, they die from gastric ulcerations. Right? So this is how important stomach as interference field in these patients. So I gave this patient bryonia and improved headaches and also anxiety and depression. So this is how homeopathy works. If you get the right remedy, like everything in the body gets better. It's same as neural therapy. You think you treat the headache, but everything gets better, right? Tuja is interesting remedy. It's also left-sided, right? It has all kind of symptoms. I didn't find it actually helpful, all the symptoms, like better when bending head forward or better when head back. Because for this, what is important that they frequently feel it as a nail in the left temple, right? Then I consider, and left temple, right? So then I consider this remedy that it is a possibility, one of those left-sided remedies, right? Yeah. In order, it's a challenge to prescribe Thuja based on the headache symptoms. So you have to really look at the whole picture of the patient, right? They have tendency to have sexually transmitted disease, cystitis, urethritis, condylomatous warts, and of course they will not tell you about it unless you ask them, right? So you have to ask them. They are good in covering up. They don't like to talk about this, right? But it is very important piece of information. They have tendency to have arthritis, especially of the right knee. So, and why right knee? Because it coincides with the sexually transmitted diseases. If you remember the course back in medical school, gonorrhea, if untreated or treated inappropriately, eventually they may develop right-sided right knee arthritis. Right? And you don't need to have gonorrhea specifically, it may be any sexually transmitted disease. But when I see, in general, when I see a patient who has only arthritis of the right knee, I always think about pelvic area, right? And I treat them in neurotherapy-wise also. I consider having the interference field in the pelvic area. They also have tendency to periodontal disease of any kind, and they also have issues with like chronic pharyngitis. And another thing is, for example, if headache started after vaccination of any sort, it's also a call for Thuja remedy, right? Because it's for the last 200 years, homeopaths use Thuja to offset the poor bad effects of vaccinations. Another thing is, and I didn't include this one in my book, homeopaths consider Thuja a remedy of reluctant vaccination, meaning that if the patient has inborn problems, we consider that it could be Thuja also.
What do you mean by inborn problems?
Inborn hemangiomas, for example. People are born with hemangiomas.
Oh, I see. It doesn't matter where.
It doesn't matter where.
No.
Doesn't matter where. But we use Thuja to treat hemangiomas, actually. So when I have a patient like Thuja type, I always consider Frankenhauser's ganglion injection because of all these issues with in the pelvic organs. I consider palatine tonsil injections, pharyngeal tonsil injection. This is their weak spot, and they frequently have interference fields there. Now, if a patient has headache in the vertex, I consider these two remedies, Thuja and Simicifuga, and we spoke about them already. Thuja will feel in the vertex as a nail, right? And Simicifuga has kind of, you remember I said that this is a female remedy, one of the female remedies, right? And Simicifuga in the vertex feels like a pressing sensation, pressing outward. Or sometimes they have strange sensations in the skull, like as if skull is open, as wind is blowing in the brain. So, but if the patient tells me of any strange sensation in the brain, and sometimes they say, my brain is moving there, all sort of strange things, I consider Simicifuga for this kind of stuff. Menses aggravate everything in these patients. That's another symptom. And they have tendency to postpartum issues. And for example, this is very depressive remedy actually. So when a patient who has postpartum depression or had a history of postpartum depression, I also consider Simicifuga. And they have tendency to rheumatic issues, which is maybe another confirmation for this remedy. When headache in the vertex looks like a heat, I consider two remedies, lycosis and sulfur. Lycosis, we spoke already about it. It's a female remedy, worse before menses. So when I repeat it 4 times, you will remember lycosis for sure, right? So worse before menses, better when bleeding starts, right? Another peculiar issue of lycosis headaches, or lycosis type of patients, that they have issues, they cannot wear tight clothing, right? And they don't like their neck to be touched, especially you would never see a scarf on a patient like that, right? And in neural therapy, I see them because they tell me something like, oh, you can inject anywhere, but don't inject here, right? So you have high chances that this is lycosis patient. And they wake up to aggravation. We know about that already. Now, both remedies, lycosis and sulfur, worse from heat of any sort. Their headaches get better with cold applications, and also sulfur headaches sometimes start after suppressed skin eruptions. Sulfur is big on skin problems. So this was a case, a 66-year-old man who came complaining of heat on top of the head, and he came to me with an ice pack on his head. And when I interviewed him, I found that he had skin eruptions that he suppressed with some of the cortisone type of creams a couple of months prior to beginning of headaches. So I gave him sulfur, and it cleared his headaches. But eruptions came back. But this is actually a good direction of healing. Problem is coming out to the skin, right? And usually when you get this kind of situation, you have to tell patient that it's a temporary aggravation, so they get better. And when I have a patient with a headache on top of the head, I consider splenius capitis, check it all the time. So now, when we talk about occipital headaches, these are all remedies we already discussed, right? Semicifuga is the right-sided and the right side of the occiput. Silicia and gelsemium, they start in the back of the head, right? Sanguinaria starts in the right side, actually it starts in the right side of the neck or shoulder, but it may at some point be in the back of the head, right? Spigelia starts in the back of the left side of the occiput, right? So if you catch patient at this time when it just started, then you will see this patient, she will complain with the left occipital headache, right? So this is a summary again of this, which remedy I think of when they tell me about occipital headaches, right? And severe bryonephlugia, they start here, but they may end up here also, right? So you may, so that's why it's important actually to ask patient. For example, he comes and says that I have headache in the left temple, so you ask, where did it start? Right? So then you will have enough information to choose. Okay, good. Please with that. Now, how to prescribe on distribution and qualities of headache. When patient tells me that the headache feels like a band around the head, I think of these 3. It's mercurius, because it's very specific. Mercurius to have headache as if a helmet, right? Gelsemium, because gelsemium, as I said, starts in the back of the head on both sides, and then it goes and engulfs the whole head, and they may sometimes express it as a band. Right? And sanguinaria is like a half of the band on the right side of the head. Now, when headache is like a nail, feels like a nail, these are, we discussed already, semicifuga on the right side of the occiput, right? Phlugia is as a nail in the left temple and in the vertex it may be. And there are two more remedies that I think of when headaches. It's Nux vomica and Ignatia, right? So what are these remedies? So Nux vomica is a very interesting remedy. It may feel as a nail, but it's not important really because we choose it on different grounds. This is usually headaches in a patient who is workaholic, who abuses coffee, tobacco, alcohol as a stimulants to keep themselves running, right? These are usually type A, what we call type A personality. These guys are irritable and angry. Headaches are worse in the morning, and they are very sensitive people. So the headache may be aggravated by mental exertion, by anger, by noise, by odors, touch. And this is my favorite remedy for hangover headaches. And also it's used to treat the initial stages of liver cirrhosis. Okay, now Ignatia. I think of Ignatia when the underlying emotion is a grief. And it may be a grief about a lost loved one, for example, or sometimes it's a homesickness also. Their headaches is worse with mental work, with strong smells, and these are weepy patients. They may be weeping, but they don't really talk about their problems. You have to really get from them. So they're not complaining. So when I see patients like Nux vomica type of headache, I think of liver as interference field because they're angry. Anger is related to liver, and they abuse stimulants also. It's an indication for liver as interference field. So I do quaddles C3, C4, T6, T10, and of course I do the point in the upper part of trapezius and above the right eye. Right? So when I have patient with Ignatia type of headache, right, I think of interference field in the lungs because grief is emotion that is we connect it to the lungs. And also for Ignatia, pains as a nail are like a hallmark. So they may have pain as a nail not only in the head but anywhere in the body. So when you have a patient who complains of pain as a nail or as if he is stabbed, I think of this remedy, Ignatia. Now let's talk about female remedies. We already briefly mentioned all of them, so let's discuss them. So all of them are worse around menses. So it's a sort of a must in every headache case. If it's a woman, and most of patients with headaches are women, it's important to establish connection with menses. So they all are worse around menses. And they're all better with open air. There are two remedies, pulsatile and lycosis, that we call warm remedies, meaning that they do not tolerate warm environment. They prefer to be in a colder environment. CP and semicifuga are cold remedies. They prefer being in a warmer environment. Psychologically, these three remedies, pulsatile, CP, semicifuga, these patients are weeping frequently. And what it means, they may talk about their symptoms and they weep. Right? And these two, CP and semicifuga, are irritable with a sense of anger. So if woman is talking to me and weeping when discussing her symptoms, and she doesn't have I don't feel any irritability or anger in the conversation, this will be pulsatile, because pulsatile is very kind and soft person. So when I have this in all of these patients. Neurotherapy-wise, I consider pelvic plexus, umbilicus, thyroid, and epipharynx injections. Basically, I treat them as I treat hormonal disorder in sexual area. Now, let's talk about each remedy more in details. CP, again, left-sided headaches, start around the left eye, extended to the occiput, better with intense exercise. So remember this about CP, you will find it. They have tendency to all kind of gynecologic problems, postpartum issues around menopause. Interesting sensation that this patient may present to you. They have bearing down feeling in the uterus, or sensation that they may describe it as a lump or ball. And it's because they are prone to uterine prolapse, even if they were not diagnosed with it yet. Probably because they have weakness of ligaments of the pelvic floor. These are chilly patients, they're weak and unbearable. Now, pulsatile headaches. I frequently use it for headaches in menopause, and very important symptom is that they change in location. Today's pain is in one area of the head, tomorrow it's in a different area. And they have tendency to light menses or to amenorrhea when they're in childbearing age. So if a woman tells me that headache, all kind of things about headache, but she complains of heavy bleeding, that's unlikely to be pulsatile. They are more on the light menses side. And they are worse from warmth. And these people are pulsatile patients. They love fresh air to the degree that even if it's cold, like for example in wintertime, they will open windows to let the air in. Semicifuga, we discussed this one also. Headaches in the vertex pressing upward, or headaches in the back of the head as a male and the right side of the occiput. Worse with mental, cold aggravate everything in these patients, right? And they have tendency to depression and tendency to rheumatic issues. Lycosis, this is the fourth time I'm talking about this thing. Worse before menses, better when bleeding starts. Left-sided headaches, worse in the morning on waking up, and this issue with the neck. Right, so remember that one. And these patients psychologically are sexual, jealous, critical, and suspicious. On the first encounter, you may not see that except for sexuality that you may notice. It's difficult to trace this. You have to know this patient better, then it may come up. If they suppress sexuality, they may become religious and loquacious. And anytime I see a patient who talks a lot, and there are such patients sometimes, you probably saw them, they just talk and talk and talk and fast, right? I always think first, isn't it lycosis? And loquaciousness, the reason for that is because in general, lycosis is better not only when bleeding starts. Lycosis symptoms improve with any kind of discharge. Any discharge. For example, if they have a verbal discharge also, so if they suppress themselves, like sexuality, right, then they become loquacious. It's a kind of discharge. Now, how to prescribe on what makes pain better or worse? If a patient comes to you with a tight bandage on the head, right? These are 4 remedies that I consider: belladonna, gelsemium, silicia, magnesia phosphoric. Another name for silicia is silicus. If headaches are better with pressure, I think of belladonna, magnesia phosphoric, and bryonia. But bryonia is interesting because It's better with hard pressure and worse with light touch. So it's very peculiar. If headache is better with a cold application, right, and the patient tells you, I just put cold pack, these are 4 remedies to consider: belladonna, sulfur, pulsatile, and lycosis. So we see it's easy actually. If headaches is relieved, there are some patients who they put some head cover when they go to sleep, right? So they cover their head, right? This is silica usually. So these are 3 remedies that are the most cold ones: silica, fuji, sepia. And these are the hot remedies or warm remedies: sanguinaria, bryonia, pulsatile, natrum sulfuricum, and sulfur. Now, if patient tells me that weather affects their headaches, I'm very carefully listening because you can find remedy through that. Right? Wet and humid weather, there is a remedy, natrum sulfuricum. We'll discuss it in a minute. Just consider that one. Headaches worse with the sun: belladonna, sulfur, lycosis, glonoid. Right? If some of the patients, and you probably saw them already, if they tell you that their headache is worse if they wash their hair and then they didn't really dry them well and they went outside and developed headache, this is like belladonna type of headache usually, right? Now this remedy, I thought whether to include it or not, because it's very special one. It is, it goes in the group of no salts. I'm not gonna go deep into this remedy, but this is symptom. If patient tells me that they're better at the seashore, symptoms get better at the seashore, right? They just present to you this symptom. I can't miss it. I decided I'll put it here. Maybe you go back home and you'll have someone who tell you this. And it's not about being in a stress-free environment somewhere in Bahamas, right? They specifically say that. Anytime I'm on the seashore, I feel better. And I don't even ask for this symptom. They usually tell me about it because they consider it very strange and unusual. So patient just tells about his headache and says something. And by the way, this is very strange, but this is what Medorina. Now, how to prescribe on concomitant symptoms? Weekend headaches. When the patient has headaches only on the weekend, who saw patients who have headaches on the weekend? I'm the only one?
No.
All right. It's not frequent, but it's, okay, what do we do with it, right? They're called relaxation headaches. We don't know why they happen, but the speculation is that they may be due to abuse of caffeine and sugar during the weekdays and lack of those on the weekends. And these are hard-working people. They love their job. So in a way, you may think of it that it's like nux vomica. But the difference is that nux vomica patients are angry and irritable, and these patients are not. They're actually very lovely people. Iris. And iris also is a pain in a small spot also. And interestingly, I've seen it only on the left side of the temple, but it's not actually in the homeopathic literature, it's not presented as left side. But this is this is what I see. Important issue with them is, as we discussed, that vomiting with a very sour taste. It leaves very sour taste as if a vinegar. And they may complain of burning sensation in the guts. and also diminution of vision before headaches, so kind of aura type of situation. If headache is with vomiting, right? So I think of these three remedies. Sanguinaria, belladonna, iris. Sanguinaria is the only one that feels better when they vomit, right? Belladonna and iris don't feel better. But this is actually important. When the patient tells me that she must have a meal at regular times, otherwise she will develop a headache, right? Who saw this kind of patients? Again, I'm the only one. Interesting. Maybe you start asking, right? This is like a podium. This is easy prescription. They have to eat on time, otherwise they have headache. And now, how to prescribe an etiology of headaches. Headaches, head injuries, I think of these two, arnica and natrum sulfuricum. If headache developed after vaccination of any sort, I consider Silicia and Fugia. If menopause childbirth we discussed, suppressed eruptions, sulfur. So now let's talk about post-traumatic headaches, because this is actually quite big. These two remedies, arnica and natrum sulfuricum, if you remember these two, you will cover probably 80 to 90% of cases of post-traumatic headaches. So when I was studying this subject of post-traumatic headaches, I looked at the literature and I found that they consider post-traumatic headache, the headache developing within 7 days of injury after regaining consciousness. And we as a neurotherapists know that it's not 7 days, right? It may be like few years, right? Another interesting thing that I found, that, and this is from the recent articles, that there are currently no accepted therapies for post-traumatic headaches, right? And we as a neurotherapists have actually therapists for that are accepted in our circle. So we're in better position than the mainstream medicine. What they do, therefore, they just give them painkillers to treat their headaches, right? So in any patient with headache, I check if there could be a traumatic event that preceded the headache, right? And they are more frequent than we think. And the reason for that is that frequently patients don't remember about the event, about trauma. They were either kids or their parents were not present, they didn't tell them, or parents forgot about it, they didn't tell them, or sometimes they don't even conceive the event as a traumatic concussion of the brain. So in our medical world, doctors really consider, they call it also post-concussion syndrome, this kind of stuff. But concussion is not really, as a diagnosis, that important to develop a post-traumatic headaches. And of course we do crown of thorns, and good reason to do crown of thorns for patients with headaches, because you may get exactly in this situation that patient doesn't remember about having traumatic event, right? And when we treat head trauma, we have to inject the area of impact and the counterclockwise area of counter shock, right? So if you do crown of thorns, you have high probability to inject both, right? And if the patient have no clue that he had, for example, traumatic event, right? That's a good thing to do. So number one remedy for post-traumatic headaches is arnica. And the reason for that is that arnica is indicated in cases when there is extravasation of blood. And there is extravasation of blood in every case of trauma. And we even, if you look at the MRI of the patients for post-traumatic after concussion, for example, there are microvascular changes on the MRI, which is the same thing as microvascular injuries, right? And of course, if the patient had subdural or epidural hematoma, this is clearly arnica kind of situation. Arnica we can use in acute and chronic cases. Another remedy is natrum sulfuricum. And doctors who didn't study homeopathy, they usually don't know about this remedy, but it is very powerful remedy for post-traumatic headaches. You have to remember that. While arnica we use in both acute and chronic cases, natrum sulfuricum we don't use in acutes, it's for chronic cases. And the main sort of indication for it is change of personality or mental changes after head injury. Arnica, well, natrum sulfuricum is a warm remedy, and this is the way actually it's easy to find it in some cases. So meaning that they prefer being in a cold environment. And also they are worse in humidity. Right? Now this was a very interesting case I had 1 year ago. A 16-year-old boy who had severe headaches for 6 years. Basically, the headaches started at the age of 10. And his mother brought him to me. His mother was a doctor, not just a doctor, but the head of a very big university hospital. So the boy was already seen by a lot of very prominent neurologists and even neurosurgeons. And the consensus was that he has migraine headaches. And the boy was on daily ibuprofen. So I asked the mother whether there was injury, and she denied it. She said, no, there was no injury. Then I asked another tricky question. Was the kid involved in any sports before age of 10? And he was a trampoline jumper from 5 to 9, right? So then I asked her, why did he quit at the age of 9? And she said, listen to this. She said, the boy told me he's tired of, he didn't want to keep hitting his head. I just quit exactly like this. And I thought, like, do you hear what you're saying to me? So this was a case of natrum sulfuricum, right? I gave him natrum sulfuricum, and for this year he didn't have a headache at all. And this boy refused actually to take any needles, so that was the only thing I gave him. So in this case I used natrum sulfuricum because the boy came to see me, he was in, everyone was in a jacket, so it's like this, everyone was dressed, right? And he was in a shirt with unbuttoned the top, and I asked, like, where is his jacket? And the mother said, oh, he never wears a jacket, he's always hot. So that was easy prescription, natrum sulfuricum. Now also, when the headache starts early in life, I can see the possibility that the patient had head trauma during birth. 5 minutes over, thank you. So keep in mind this one, right? Any kind of case of difficult delivery, for example, right? Now this is an interesting case. I had a young woman with head injury. She had a very serious motor vehicle accident, and she came to see me 2 years after that. She had epidural hematoma, surgical intervention, developed epileptic seizures and bad headaches. I started case using arnica because there was epidural hematoma, right? So it was obvious. It cleared her seizures and improved headaches, and then later I switched to natrum sulfuricum, which cleared the rest of the symptoms. That's what you can do. You can start with arnica and then go to natrum sulfuricum. Now, surgery could also be a traumatic event, right? We know that as neural therapists, but other doctors don't, right? So this was a case of, especially if it is the area of the nose, I found that actually is very traumatic. So this was a case of 32-year-old man who complained, actually he complained of left-sided sciatica and neuralgia paresthetica type of numbness, right? but when I interviewed him, I found that he also had this right-sided temporal headache, partial hearing loss, and tinnitus. And all his symptoms started 4 years ago. There was no history of head trauma. He denied it, right? But I found that he had a couple of months prior to start on the symptom surgery for nasal polyps and deviated septum. And he told me, I never felt well after this surgery, so I thought something was wrong during the surgery. But ENTs did all the tests to find what's wrong with his hearing, and they found nothing, so they said it's unrelated. And of course, no one even considered that sciatica could come from this, right? So we know that it can, but they don't. So I did neural therapy for him, and I gave him natrum sulfuricum. And I gave him natrum sulfuricum also because he was also a hot guy, right? When I was doing neural therapy, he was always unbuttoning, and so this is what I use neural therapy wise. I treated his I treated him as the main zone was here, right? So I don't use actually injections into nasal contact. I use Q-tips with lidocaine. Who uses Q-tips with lidocaine?
Okay.
Yeah. So if you don't, you should consider it, at least for patients with headaches, right? Because this zone number 3 is called cervical zone, and it's good for cervical syndrome, vertigo, tinnitus, migraine, anxiety. This is really great stuff. And also, you block, actually, you anesthetize some of the branches of sienna-palatine ganglion with this kind of treatment. And another thing is the patient is lying on the back and ask them to bring their chin up. Lidocaine spread into the area of pharyngeal hypophysis. And in the cases of head trauma, hypophysis is frequently also suffering, right? So we treat that also, yes.
So which concentration of cytokine and for how long?
I use 2%.
2%.
2%, yeah.
And for how long do
You may use 4, but 2 is enough, it works well. Also, in this case, I used, of course, these points as I treat sinusitis with this area, right? Ganglion sphenopalatine. I used the mastoid injection, mastoid ear program, and yeah, I think once I did also injection for pharyngeal hypophysis, and I didn't even touch his low back, actually. It was for fun, I didn't even touch it. So he had at the end complete resolution of all his symptoms and sciatica and hearing loss. Right? Okay, this is now this is interesting.
Actually, we got you there.
Yeah, let me. I will answer your question. Injected for the most part. 1 minute. So I choose for kids. I choose between calcareous phosphorica and magnesia phosphorica. Mostly calcareous phosphorica. Remember this one for headaches and school children. And what's with this calcareous phosphorica? They're worse after mental effort. And in advanced cases, they're worse even from physical effort. And they have low vitality. This is cold remedies. They're cold kids, right? Actually, as a kids, they may not see it, but later in life, they're cold, right? And headache also start in the morning on waking up. And the reason for this whole thing is because brain is the very energy-consuming organ. Kids, they have less than 3% of body weight brain constituency, but it consumes more than 20% of energy of the body at rest, and at the time of mental effort, up to 40% of energy. And teenagers, they have this rapid growth of bones in this time, right? So, and rapid, not bones only, which leads maybe to difficulties in sustaining mental effort. They don't have enough of energy, right? So parents think that sometimes initially they think that the kid just don't want to go to school, right? but they really can't mount this mental effort to learn, right? And what is calcaria phosphorica? Chemically, it consists mostly of calcium phosphate, which is the main building material for this rapidly growing bones in PMHs. So this is the easy way to remember calcaria phosphorica for growing kids, right? And they also may have issues with scoliosis. Calcaria phosphorica, when you see a kid with scoliosis, think of calcaria phosphorica also.
Okay, great.
Thank you.
Thank you. Yes,
Thank you
please.
so much.
Yes, now I will.
Can you repeat the question?
We'll have time, I'll talk about dosages. Right. So if you're new to homeopathy, you just start, and I suggest that you start with low potencies, like 6C, because you can use them 3 times a day, and you can use them 3 times a day, and actually that's what patients are used for. So if you give them 1 dose, and they will get better in a week, they will forget about it. They will not even connect it, because they don't think that really